Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This one thing will make you live longer with less pain. Boy, that's intriguing.
Yeah, and it's true.
And you better not be lying.
But the one thing is, it's kind of a bigger one thing. It's a big picture.
It's all-encompassing.
And you'll see in just a minute. But Bob, shall we?
If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, go over to the Facebook and find Bob and Brad, and make sure you like us, because we're going to give you positive vibes if you like us.
Yeah.
Ooh, it's kind of scary.
Okay, what is the one thing, Bob?
Yeah, let's jump right into it.
Well, you know, I'm talking about one of these talk shows I was listening to, and the host was talking about how there are studies done where people who are more educated have longer lives.
Mm-hmm.
Okay,
Which makes sense.
They live longer.
Right.
And that's not saying everyone does, but in general, the studies show the majority. And I started thinking about it. Yeah, it does make sense. And what we're going to do is take that and relate that concept into the health field and keeping ourselves, just
Healthy
like you say
and
at the
fit.
beginning,
Yeah.
healthy, fit, and active, pain-free. So what we've done is we found, and I think both you and I agree, you can watch our videos, which is definitely going to help to get that goal. But the thing you can add with that is get a paper book out or your Kindle out and do some reading on the subject. And there's something about reading that just allows your mind to assimilate the information better.
Go at it from two angles.
Right,
basically.
exactly.
Feed the mind visually.
Right.
With video, and also, I guess that's still visual.
Right, but that just makes the mind work better. If you're a reader, you know what I'm talking about. I'm not a real big reader. Bob is, but I'm working on it, and I'm getting better as I grow older. We have a section in our favorite products that is dedicated just to books.
And on our website, too, it has our favorite books section.
And they're books that Bob and I have read, and we feel they're excellent books for the layperson.
These are solid. I have no qualms about any of these books. They're really decent, good books.
And you don't have to be a physical therapist to understand. They're actually, the ones we have on there, most of them are for the lay people that are going to help you understand the medical field, understand your body more, and understand how to reach the goals of feeling fit and pain-free and live longer.
So what we're going to do today, we're going to actually read every one of these books to you live right now.
Yeah, it's going to be like
you'll
audio
have to
cassettes.
Yeah.
No, we're going to go through it. We don't have all of them here. We've got a few. The one that's not on our site yet, but it will be by the end of the day, is this is one of my favorite books. I've read it once, and I use it for reference books now. It's called Overdiagnosed. It's by Dr. H. Gilbert Welch, and two other doctors wrote it. He's the primary author. And it really goes through Western medicine, mostly in the United States, and I don't know how that relates to other cultures. But he really goes over things that are common illnesses in the United States, like high blood pressure, diabetes, high cholesterol, breast cancer, and he goes through, and there's a number of other ones, and he goes through those and he talks about how you're diagnosed with them. And there's often times where maybe overdiagnosed, or you're diagnosed with something with an incorrect diagnosis. And, because there's information from an MRI that a doctor gets from the radiologist, and the doctor literally has to take that information and decide the diagnosis. And we know
he combines it with what he's seeing clinically, too.
Right.
And quite often, I think sometimes they put too much emphasis on what they see on the images versus what they're seeing in the clinic.
And that's exactly what he talks about. And he goes through all using scientific studies to support his findings.
And Brad and I must be of the same nature, because I read a book similar to this years ago, and it was one of my favorite books too.
Sure.
So do you know when this one was, do they have a more recent version of this or not?
I believe it's 2011, so it's not
terrible.
Real recent, but the concepts and information are going to relate. They're going to help you out. When you go to the doctor, it's going to give you a good base of what questions to ask.
Right.
Because sometimes you'll sit there and
you just accept it, and you really should be questioning. What your diagnosis.
Right. One big question is, if they come up with a treatment, you can always ask, are there any other alternatives
Right.
besides taking this medication or doing that? And then you can,
Or what will happen if I don't take the medication?
right,
You know,
right. Are there any studies on outcomes of how this treatment or how this surgery worked on other people, as opposed to just saying, well, the doctor says take the medication and have the surgery. I guess he knows what he's talking about. Don't get me wrong, doctors are incredibly intelligent and very meaningful. They really want to do the best for you, but they're busy people.
They're very busy.
And the body is complicated.
Right. And they're thinking about, well, I got to get to my next patient, and they don't have that much time with you.
They're human too.
Right.
So Overdiagnosed is definitely going to help. The other ones, we've got a series of the McKenzie books.
Yeah, we're big fans of these. Great self-help books. They go through almost most parts of the body.
Right.
They've got one for the knee, right?
The extremities. I don't think it's just for the knee. We've got the neck here, we got the shoulder here, and the back.
Yeah, they didn't have one for the knee, did they?
Well, we don't have the extremity book on for the arms and the legs, but that one will be coming, I think. But these we promote a lot. By Robin McKenzie. He's not alive anymore, but he dedicated his life to physical therapy.
Yeah, and the thing is, they're thin books, but they're I mean, they are.
Yeah.
So you can read them fairly quickly, but they're basically tell you step by step what to do to take away your neck pain, what to do to take away your shoulder pain, what to do to take away your back pain.
Right. And our videos will just overlap with that information.
Right.
So they support each other.
And well, you know, it's interesting. I've given this books to some of my friends sometimes, and they literally got better just by reading this book.
Oh, right.
I mean, so it can be done.
Yeah, as a matter of fact, the back book that we have, someone, Zach is using it right now.
Oh, really?
Yeah.
Oh, no kidding.
Yeah. Well, he's got the leg pain that we're having we're trying to figure out. Yeah, so he better be reading it.
All right. Sounds good.
And then this is my second favorite one. This book is called Shoulder Pain. It's by Dr. John M. Kirsch. And it talks about how to cure shoulder pain by hanging on a bar.
Brachiating.
Yeah, brachiating. Just like this, I'm going to get in front of the... this simple treatment, before I read the book, I would have said, that's quackery. That's not going to do anything. And he goes through it. He's an orthopedic surgeon. He goes through why it works. He has studies that support it.
He has a lot of case studies that support it. It's really changed the way Brad and I look at shoulders.
Right.
And even the way we're treating our own shoulders.
Yep. And it's so simple that the treatment you can do at home is just a wonderful book for anybody that has some shoulder problems. So there you go. And we've had great responses from our viewers saying, I've been done this for a few days and my shoulders are already feeling better.
Very cool. This is more of a recent one. It's on sacroiliac pain. A lot of people have been buying this one, Brad.
Right.
It seems to be an area that was not being fulfilled.
Sure.
It's got a series of exercises, basically. I'm jumping in here. I hope that's
Go ahead, Bob. Jump in.
A series of exercises, and they all make sense to us anatomically,
right.
Brad and I, when we're looking through them. So I think you'll find something that will help you if you truly have SI pain.
Right. I know a lot of people, women, after pregnancy, the SI joint can become dysfunctional or loosened up a little bit. And this is good exercise to get that solidified and get it strengthened up. And that's by Dr. Deborah B. I don't know if I'm pronouncing this right.
Rixo.
Yeah, she's a doctor of physical therapy, very intelligent woman, and she's really done a lot of research.
Yeah, master's degree in education too.
Yep.
So
yeah,
well educated.
So go to our book section again if you want to get some information and really have something to get help yourself out to get to that goal of being healthy, fit, pain-free, with less doctor visits, which is always nice.
Yes, Bob and Brad can read. All right. Thanks, everybody, for watching.
Well, we don't have a book on the broken heart, though.
Oh, that's right.
We're working on that. We'll write one.
Okay.